everybody. Welcome to Ask the Anabolic Doc, starring Dr. Thomas O'Connor, brought to you by his websites metabolicdoc.com and anabolicdoc.com. Also, he has an awesome YouTube channel called Anabolic Doc. Dr. Thomas is the author of America on Steroids, A Time to Heal, which is available on metabolicdoc.com or Amazon, where you're probably going to buy a bunch of crap anyway. Might as well get his book. How are you today, sir?
Excellent, Ron. How you doing, man?
Doing well. So, the last video we did, I got so much heat over that. It was right in the midst of the whole Sean Roden rape charges, and that's still an ongoing story, of course. But a week ago it was really broiling, and everyone was just freaking out over it. So we called the video. It was a question: can steroids make you a rapist? And so I got a lot of heat from guys saying, now you're putting that question out there, and you're putting that in people's heads. Now they're gonna. No, that would have been the case if I said steroids make you a rapist! Exclamation point. That
yeah.
Would have been, so to try to appease these people, I changed the title on YouTube to "Steroids Don't Make You a Rapist." Still wasn't good enough for them, but
oh my Lord!
I tell you, I can't keep everybody happy all the time. It's almost impossible.
You're trying hard, though.
But
I told you, don't give up on that.
I know. I mean, I thought we did a good job, especially you always have the science behind everything, and you have studies to back everything up, and you're referencing data and case histories from working with thousands of patients yourself. So it wasn't just you guys bullshitting and trying to clickbait people. Anyway, let's move on, Doc. How about that?
All right.
I saw, we published it on the website, and it's already been in the magazine. It was an MD rant that Steve Blackman wrote about a study. One study here and there doesn't necessarily mean anything significant, but this study found aging men, and they consider aging 45 and up, so I'm aging men with low T levels who take TRT are at a slightly greater risk of experiencing an ischemic stroke, transient ischemic attack, TIA, or myocardial infarction, especially during the first 2 years of use. The study analyzed a database of 15,401 men aged 45 and older with low T. Users of TRT had a 21% greater risk of cardiovascular events compared to non-users. The increased risk declined after 2 years, which investigators attributed to a phenomenon called depletion of susceptibles. First of all, were you aware? You must have been aware of this study.
I've seen. When was that came out? When did that come out again? What was it?
I should have checked that, but I'm not sure when it came out.
I saw that. Yeah, I saw that out there. The problem with these studies, and the initial study that is really the main study, was a JAMA study in 2013, and then there's a 2014, and then after that, the feds in 2015, the FDA put an increased warning on testosterone products, saying heart attack, stroke, and death.
Wow.
Potential.
Yeah.
And that study, again, I saw that study. The statistical data is erroneous. It's the way they're collecting their data, and that was criticized also by other experts in the world. So here's the bottom line. If you're a man and you have a susceptibility to having a heart attack or a stroke, it's called vascular disease.
Yeah.
It's really essentially more or less the same process, where if you have a clogged artery in the neck or in the brain or in the artery, that's versus a stroke where you're bleeding or you're launching off pieces of clot from the carotid artery or down in the heart. That's an embolic stroke. So without getting into all the too much details, if you have blood vessel disease and then you put men on androgen, can you worsen that state? And the truth is, yes, you can on some of those men, but on these studies, their data has not reached significance statistically.
Okay.
No one could argue me. But if you look at men, because no one has a bigger case study than me going on, or a data bank that I have going on, and I'm announcing next week. I'm finally going to announce the big association and collaboration who I'm working with next week.
Okay.
We're not there yet. We hope this weekend's going to be big. I'll be flying around the country doing some stuff, and we'll see if it works out. It's all legal. I have to get through the legal stuff and the IRBs and all this kind of jazz. So And I don't, it just, we'll see if it comes through. It should come through, but when it does, I'm going to blow the world away. So, because this is real research, people, real research with a huge level, Division I, huge centers of excellence for medical research. This is not some little place down the road. And I love UConn, where I teach at University of Connecticut, but I just haven't decided to pursue the specific type of research with them. I just, because they're not interested in that type of research that I'm interested in. So bottom line is, those studies are not, they're not good studies, but they're enough to scare you. So if you're going to use testosterone, even forget steroids. If you're going to use testosterone, you may be at risk for a stroke or a heart attack. It's true. So there you go, Steve. It's true. So it needs to be taken in a man-per-man basis, and you need to look at the risks individually for vascular disease, blood pressure, cholesterol, diabetes, and then other hypercoagulable states, family histories. I say the same thing like every week, though?
Like a broken record. But
I mean, people should just either listen to me or hang up or something. I just don't even know anymore.
The really puzzling thing to me about that was that the increased risk it fell off after 2 years. Do you have any idea why the risk would?
What they're talking, there's different statistical ways to evaluate data, regression to baselines, and what that was, and I didn't look at the real nitty gritty of the study, but I remember looking at it, and I remember looking at the statistical, the methodologies, if you will, which is we kind of go right, doctors, anyone who knows it will go right to that, and then you start getting into it. And that's really the statistical methods of how they set it up. Is it retrospective? Is it randomized? Placebo? Is it running forward in time? Or is it just retrospective, like collecting data with different types of data collective methodologies? And that's where it starts. They start to, in the discussion part. And this is why you got to be like a smart doctor or at least a researcher. You have to understand statistics. And you have to be objective, right? So it gets very complicated. You can't just say you can do, and that's why we don't believe a lot of studies that are done by the industry, industrial, that they're obviously they're trying to sell something, and they have the small print. This has not been done by, but people love snake oil. They love to buy things, and they like to have hope. They love to have hope in things. So when it comes down to some of that may show that maybe, if you have some vascular disease potential, boom, you're going to have a heart attack or a stroke early, and then if you don't, you're going to be fine later. So we're kind of teasing it, right? I mean, you're going to pick the low-hanging fruit. If you're going to have a heart attack and you go on testosterone, you could have if you're just before having a heart attack, you take testosterone and your HDL goes down, your LDL goes up if you're that person, and your blood pressure goes up, because it does cause edema. Puffiness, and edema leads to hypertension. It's estrogenic, and if that pushes you over the edge, voila, you have a heart attack or a stroke. Okay. It's not that simple, though. So maybe you tease out, then you see that manifestation, and then later on it clears out, and then the people end up, they're safe and they're stable. Is it protective? You can't say it's protective. I take a very aggressive approach, where every man I talk to, I do the same thing over and over. I look at the heart, the prostate, the red blood cells. I just got off the phone. I reviewed 4 guys in the last couple of hours. That's all I do all day long. Making sure they're safe, and it's just so fun to talk to these men and make sure. And I work with doctors all over the world, cardiac doctors, kidney. It's crazy. I mean, so the studies, I think testosterone for the right man, I'll say it over again, if he's managed properly, is safe. But you have to have aggressive management.
Yeah, now you've said this before, but isn't low testosterone more of a risk?
Low testosterone this is the paradox. Yeah. Low testosterone is definitely a danger, but we can't say that treating testosterone is going to protect you necessarily. You understand that, though?
Yeah.
You can't say that. And guys, the anti-aging, douchey, hold on, I'm professional. The anti-aging facilities, anti-aging. Oh, so your anti-aging guys, are going to utilize all that data, but they're straight up liars if they know what they're doing, or they're idiots because they're just selling bullshit. So if you have low T, yes, you're at risk for not living long. But you have those are men that are sick. So they have low T because they're sick. So it's a tough association. Does it mean that if you just replace testosterone, you're going to live with poodles for a long life? I'm sorry. I just have to have fun. I get bored up here.
Sometimes you get like I watch your videos. Sometimes you get like super mad for like 1 second, and then you go. But then you snap yourself out. You go, I'm done, and then you're fine.
I get mad, Ron. I get mad at what I'm doing.
It's usually when anti-aging comes up when you're talking about it too.
I'm so guys love the anti-aging. I have so much business coming in from those places. It's just awesome. Love it. Keep up with the anti-aging clinics. Love them.
You're not going to hurt them. That's a booming business.
It's okay. It's okay. There's enough. There's enough business for all of us.
McDonald's isn't going out of business. Don't worry about McDonald's. Don't worry about anti-aging. They're here to stay.
It's awesome, Ron.
Okay, so you did a video a couple days ago called "Kidneys and Steroid Q&A."
Woo!
Fascinating.
Right.
It was the impetus for that video was a pro bodybuilder from South Africa named Marius Doan. He had a kidney transplant. And people are wondering, he'd had kidney issues, kidney failure before, and he came back to bodybuilding. He got big and jacked again, and then he had kidney failure again, and he needed a transplant. And I don't think he's going to try a comeback at bodybuilding, but
I hope not.
You never know. But that's my first question, because Flex Wheeler went through a similar situation. Probably, this is going back probably like 15 years now. Where he had kidney transplants, and he came back bigger. I don't know what he was or wasn't using, but if somebody had a kidney transplant and everything that involves, and you talked about medications that they were going to have to be on for the rest of their life, would they be incredibly foolhardy? We're talking about like a bodybuilder, someone who's very, very large, using very large amounts. How foolish would they need to be? How risky would it be for them to try to go back to bodybuilding, professional bodybuilding, to be 250 pounds ripped?
Well, they're not. They won't. They can't. They can't. And I don't know who's injecting. There's site injection oil guys. They're not. This is not real muscle. A lot of those guys. I'm not saying names. But we're all in the business together, and I've taken care of all these guys. So, they inject. The stuff that Rich Piano was using. So they're actually not. They're doing some steroids. Look, here's the bottom line. I've taken care of dozens and dozens of men, maybe up to 100 that have destroyed their kidneys from bad genetics on top of steroids and just bad luck and hypertension. Because the other guys don't blow out. Why do they blow out? Well, it's multifactorial. It's moons line up. I say the same stuff every week. So, and then they get the transplant. No one's feeling okay. So some guy said, "Doc, I disagree with you. I do feel great." Look at the comments. Everyone, look at the my videos are great because the comments that come are amazing. There are multiple men that have had kidney failure and transplants commenting. Yeah. Read the comments. That's better than anything. So it becomes a repository and just an open dialogue of men that are coming out all over the world that are giving their personal histories and kidney failure. So you're going to feel bad after kidney failure. You're not going to feel good. If you feel well and you're like, "Doc, I feel okay," or "I'm feeling great relatively," I'm happy for you. No one goes back to no man. I love saying these kind of direct, definitory statements because I want arguments, I guess. So no man is ever going to be on a pro bodybuilding stage and win any substantial pro open show after having a kidney transplant. Impossible. Okay. Impossible. I'm not saying walking around the Olympia looking like, wow. I know who you're talking about.
I'm saying, okay, say a guy does everything. He was 250 pounds lean before his kidneys failed and he got a transplant. Would he even be able to regain that physique? No, you can't. How can you be lean when you're on prednisone? And I know that there's some protocols now that they don't stay on prednisone. Okay. But most are on and you're on prednisone for the beginning for a couple of years, I can tell you that. Every single one. And you're on a bunch of immunosuppressant drugs
you don't feel anyway. So, but I'm not going to beat the dead horse. No, you won't. And you're going to be humble. Now that guy came back. That guy's looking like he's on TRT. Come on,
Yeah,
that guy's not stepping on a stage. I don't want to upset anyone or
he's not. He doesn't look the way he used to look. No.
No. But you know, the truth is, the guy does have it. I didn't even research it enough to find out that he had a kidney transplant. I assumed he did.
Yeah.
I assumed he did, and he didn't. I saw the comments that he did get a kidney transplant, and because when you go on hemodialysis, you don't come off hemodialysis with a poodle and a new car. You just don't. It's serious shit.
Well,
you go into hemodialysis.
When you're on kidney dialysis, is that for life, or do some people not have to do it forever?
It can. Well, not. I mean, yes, it can be, of course. But your life on hemodialysis is you're going to a hemodialysis center 3 times a week. It's a part-time job. You don't feel good. They're running they run you through a dialysis machine. There's infections. You're exhausted. Your electrolytes don't feel. I have a lot of people that have had hemodialysis from diabetes and hypertension with no steroid. You know, to remark for those people, when those people see other people using steroids with a healthy body, they get very mad. I've had patients here tell me that they're very upset. They're not upset at me. They actually become upset at me initially. I'm very upset with you, doctor. Why are you upset with me? Because you're the anabolic doc, and it appears like you're supporting this crazy drug. These men are destroying their perfectly healthy bodies. Look at me. I'm in hemodialysis. I became a diabetic. It wasn't my fault, and I lost my kidney function because of bad luck. And it's true. Yeah. Now we're not going to say the guy she should have not been a diabetic. We're not going there. That's just Nazism. So I mean it's true. So look how sensitive those people are. They're very emotionally. They've and this is what I'm trying to bring to the world. Here are young men that have perfectly beautiful, healthy bodies, and they are, just to greater or lesser degrees, destroying their health. And now they have of course they have the right to do it. I mean, I'm just trying to, how many guys, look at the comments, how many guys say, Doc, I don't do steroids, I love your videos because it's wild. Or how many guys say, Doc, I don't want to do steroids, and I won't do steroids because of your videos and because of your work.
Well, you can't have beautiful bodies, a relative term. You can't have that steroid look, the really big, full, thick muscles, without steroids. So these
Correct.
guys could say, I'd rather, personally, like me, I don't want to take steroids. You think I don't want to take steroids? I never wanted to take steroids, but to achieve the look that I wanted to look, I tried doing it naturally for many, many years, and I just didn't look the way, I didn't look as good as I wanted to look. And with the steroids, I got past that plateau. I put the size on. The muscles took on a harder look. People wouldn't use steroids if they didn't work, obviously.
Well, let me ask you this though. Let me hit you with this, Ron, because you're an open steroid user, and it's everyone's coming out kind of coming out of the closet. I mean, it's after Rich Piana. I mean, there was the before Rich and after Rich. After Rich, look, everyone's out there. And Boston Lloyd's just a over the top kind of guy that's unfortunately probably should be on murder charges because he's just there's so many kids that are just. First of all, Boston Lloyd doesn't exist anymore. He's fallen off the world, thank God. He's not out there.
He's in Florida. I know where he is.
I don't know, but he doesn't. You don't see him on social media. At least I don't see him on the main social media platforms. Because maybe he's gotten older and he realizes that he's not a bad guy. And why do you want to influence young children in the world by doing massive steroid drug cycles? And it's definitely going to hurt people. Who agrees with that? Now, apart from that, you're a steroid user. Yeah. You're open about it. Thank you so much. So what kind of worry do you worry about your heart and your kidneys that down the road that you're susceptible to disease and maybe?
Yeah, of course. I mean, I worry about my heart particularly. And that's why I have a cardiologist now, and every 6 months I see him. And
awesome.
At the end of the year we'll do another stress test. I don't know what else. We talked the last time I met with him.
Echocardiogram.
We're going to do another one. So I'm going to keep up with all that and keep an eye. And if at any point I see that there is further damage being done, I'll take responsibility for it and I'll step back. And there will come a time, I don't know when I will just do TRT, where I'll do.
There you go. And what I'm trying to show you and guys out there, there are millions and millions, is I want you guys to make that shift as soon as possible, only because you don't, like, when you get diagnosed, it may be it's going to be irreversible. There'll be some irreversibility to it.
Right.
I'm just trying to say the truth, and I know it's the truth. I mean, and the doctors, everyone's going to agree with me, but it's this subjective world we're in. It's such a high. You're living on a high. I get it. I've been there. I mean, I understand it. Everyone understands it, but so kidney. Let's get back into kidney.
I mean, here's the thing that I really wanted to get into with you, because most bodybuilders, myself included, we don't really think. We know steroids are dangerous. We know the heart is definitely susceptible to long-term damage. All the vessels, you can get the hardened arteries and all kinds of things in the left ventricular hypertrophy. Kidneys, something I don't really worry about. I think, well, that's for people that abuse diuretics. That's for people that maybe shoot synthol and it's leaking into their kidneys. I personally never thought, until I started watching this video you just did, that just using steroids in the amounts that I and many other bodybuilders use is very potentially harmful to the kidneys.
It is.
So can you elaborate why that is? Because
let me go into that. Again, I know in the video I say the same thing over and over. I've learned from the top expert nephrologists in the world that I work with. I'll say the name, Andrew Bombach. He's Columbia University, New York City, and Leal Hurlitz. Dr. Hurlitz is the chief of renal pathology at Cleveland Clinic. These are not like little doctors, blah, blah, blah. These are not little.
These are the top kidney experts, probably.
Okay, these are the top kidney experts that walk on the planet. Okay, they're actually very nice people too, which is nice to say. They've done studies on steroid users. 2009, big study, New York Times, steroid use versus obesity patients in end-stage kidney failure. It's called FSGS. And they looked at why and how, and they discovered some things that we know now, and they discovered some questions that we don't know. So the men that use steroids, now I'm doing a study. This is one of my studies where I'm sending patients, hopefully early, to Andrew Bombach, and I've sent him about half a dozen. And what they have is they have genes. I say it like this only because I have to wake people up, not just my med student, but other people.
Wake up, Josh.
Genes. It's not everyone. You have to have the genes for it, man. You don't know those, and don't measure those genes. We don't do 23andMe for this. We're not doing it for that. Genes, genetic, horses, straws on the back of the animal. One straw, you don't see it. Genetics. Next, you're on steroids. Maybe a lot of steroids. Definitely dose dependent. If you do a little Anavar and a little cycle of test here and there, it ain't probably going to happen. Doesn't mean you should go do Anavar. Okay, so it's dose dependent. Yes, if you're doing a lot of tests and equipoise and tren, yes. We don't know what the combinations are. That's why I'm making my study announcement. We're going to try to start looking at this, to look at the real details. So it's common sense. You have genes. You're doing steroids. Now, what do the steroids do? They lead to hypertension. If you're on blasting and cruising and you're spending a lot of time hypertensive, that's going to destroy the kidney regardless of who the hell you are. You're taking chance. You're burning up the lifespan. You're damaging. Kidneys are I call the kidneys little babies. The kidneys are very, very. I learned this as an internist in the hospitals in my training in New York City and Hartford, Connecticut. It's incredible. Little babies. The kidneys are very sensitive. The heart itself is very strong. It takes decades to hurt it and kill it. Kidneys are different. And if you go to dialysis center, you talk to nephrology guys, they'll tell you there's a lot of very, very, and when you damage the kidney, you're dusted. You're dust. You're dust. You ain't coming back. Then we start stabilizing everything, and your life sucks. Okay, so kidney damage, hypertension, genetics. Then what I discovered with Andrew Bombach is when you take too much protein in on top of too much goddamn Motrin. But can I say it over? I want to say it. Can I say it 3 times in a row?
Motrin? Oh.
Motrin. Too much protein, steroids, hypertension, genetics.
Wow.
I mean, can I say it? Oh, do I have to repeat it, please? You're taking gambling in Vegas. You're rolling the dice down. I have guys. Look at the comments. There's a couple of guys saying, I have this. My kidneys failed, and I didn't even do that much.
You're talking about FSGS, right?
Yeah.
Yeah, they reported that they were.
I was not lying.
Wow.
I'm not trying to be some sensational guy. You should stop steroids so you can take me money.
Well, okay.
Watch the monkey come down. Watch the monkey comes down and feed it a pound.
Okay, so you know, you brought
this
up
is what happens.
The high blood pressure you brought up because
sickening.
You remember who Derek Anthony was, right?
I knew Derek Anthony. He reached out to me in tears.
He
died.
Some people were attributing his death, and you'll correct me on this, to untreated hypertension that caused his kidney failure.
It's not some people talk. It's 100% why let's talk about Derek Anthony. Yeah. I knew him at the end. He had genetics for bad kidney failure. He was a good-looking guy, man. Remember him? Did you ever meet him?
Of course I met him. Yeah.
Jacked to the gills. He was massively hypertensive from not even that much steroids. He did what everyone else did, didn't he, though?
I mean, I don't know what he did, but like you said, some people, they're going to have worse luck of the draw. Some people just have the genetics.
Correct. Right. Don't. How much gambling you willing to take in Vegas tonight? So that's just what it is. And as you get older, nothing's going to get better.
Yeah.
So Derek Anthony, you're right. Derek Anthony, and so he had hypertension, protein. This is where he was one of the guys that was with the docs at Columbia. He reached out to me when I was at the 2009 Mr. Arnold Classic. He was there, and I met him there. He was working for the supplement. Remember that? He was out there, and he was still jacked.
Yeah.
He reached out to me, and I don't want to disparage his family or anyone because he reached out to me. I mean, he was in fucking tears, begging me. This is the beginning of my career.
Wow.
And I was like, Derek, and so I helped him. I talked to him. He was led. He already had very good doctors, and I said, just believe them. And then he was in dialysis. And he fucking died from infection, from a catheter infection somewhere in New York City. He didn't kill himself. I think he went septic.
Wow.
Multiple times. He was sitting there. Remember, that's when Facebook was big, remember? Yeah. And he was on Facebook, and he was like, hey, guys, here I am at dialysis. And he was like, he's a tough bastard. And to the day he died from an overwhelming infection, septic. He became septic.
Wow. Well, so, people are going to use steroids. They're going to keep using steroids anyway, obviously.
Yep.
Would that be the one thing to keep from kidney damage that you would advise is monitor your blood pressure?
So listen to this, though. This is a great point. Bottom line is this, beyond all my craziness. If you see a good doctor and you do a CBC, basic blood work, and look at your renal function and get a urinalysis and measure your vital signs. And if you're, say for an example, African American, and you have genes, not to mention itself, in your family for FSGS, and you have a mother or father that's on dialysis, or an uncle or so, please, you have those genes. It's nothing to do with racism.
Yeah.
God damn it. You are going to be susceptible to this. I've seen it. I've seen guys that my dad's in dialysis. I did some steroids. Now my kidneys are failing, and it's not even really so much. It just sped it up a little bit. I have a guy right now that's a black guy that's his kidneys don't look good. Hopefully we're going to protect. He'll be on TRT. I'm just derailing the train early. Yeah. He's going to a nephrologist up here in Hartford, and they're like, wow, thank you for saying this guy, man. We're going to be able to really work with this guy. He needs special medicines. We need to make sure we got to shrink him down a little bit. We got to keep him on TRT. Now, I will argue for him to the doctors. He's going to stay on testosterone, guys. We're going to make sure he's going to be stable. The testosterone's not going to hurt his kidneys.
Yeah.
So that they're like, whoa, maybe we stop everything. And he's like, Doc, please help me. Back him off, back him. And I am backing him off. And the guys in Columbia agree with me. All my guys at Columbia University, they're with Bombach is a badass. He keeps them all on testosterone himself. He's telling other nephrologists in the country, these guys can stay on testosterone. We need to measure the blood pressure, ACE inhibitors, look at the other parameters. This is very complicated. Watch your kidney function. Watch your kidney function. If you have protein in your urine, I just get emotional because we could really protect guys from kidney failure.
See, another thing is when we get our blood work as bodybuilders, a lot of us have been conditioned to sort of ignore the kidney function level, those values, because we've been led to believe, well, we're going to have high creatinine because of muscle breakdown, and we carry so much muscle mass, so whatever. Because the doctor, many times the doctors have sent me the labs back, and that's highlighted or circled, and they say, this is concerning, and I'm like, nah.
And it's not. That's why I feel confident when I look at a lab knowing what to do. The standard doctor is going to say, oh, you're in kidney failure, when you're not in kidney failure. Right. So you have to be an expert like me. I've been doing this for 10 years. If I don't like something, I say, you know what, sir, I'm a little questioned. This is a little question. Sometimes I say, this is just not good. And where are the doctors on that? I mean, come on, it's a shit show. We need to have a specialty for men that are on we need a doctor just for men on steroids and testosterone. End of the story. Okay. That's what we need, because we need to be able to differentiate, is it kidney failure, early kidney failure, or it's not kidney failure. You have just muscle tissue and you're fine.
Yeah.
It's not easy to, the gurus are trying, Ron, I don't want to launch you off again. It's not,
don't do it.
This is my whole day though, Ron.
The last thing you touched on the video that I wanted to reiterate here was you talked about, excessive protein consumption, which every steroid user I know takes in a ton of protein. The recommendation was the upper limit that's recommended by, I don't know who makes these recommendations.
It's nephrology. It's actually expert nephrologists and sports experts.
Okay, so the upper limit, you shouldn't have more than 1.5 grams to 2 grams per kilogram of body weight.
That's it.
So if you're a 220-pound guy that's 100 kilos, you shouldn't have more than 200 grams of protein a day.
Correct.
I know guys who are 220 pounds who will do 300, maybe even 400 grams of protein every day.
They're hurting the kid. I'm just telling you the truth. Now, when you're on anabolic steroids, you can definitely utilize more of that Again, I'm not having this argument ever again with anyone. Not that you're arguing me, but it's called deamination. When you look at the blood urea nitrogen, you see it's all elevated. Even on guys that are not on steroids, I've asked nephrologists for years, is that dangerous when they're deaminating? Yeah. The answer is we don't really know. If you talk to the real academic guys like Bombach and the Cleveland Clinic people, they're going to say it's something you don't want. So why you're straining your kidney? It's going through oxidation. There are redox. There are chemical occurrences that are happening that are damaging to the kidney. And then you're putting it on steroids. You're giving it non-steroidal. You're hypertensive. You're straining it. And it's interesting. The liver can tolerate. I shouldn't be saying these things. The liver can tolerate a lot more strain than the kidneys can.
Yeah.
End of story.
It takes a licking and keeps on ticking.
It's incredible. I'm not saying go out and do some Anadrol and don't worry about it, but I rarely see liver disease. I do see it, and I see more and more, I guess, because I'm just being inundated more and more, which is awesome. Yeah. Guys coming in from the whole world. But how commonly do I see kidney disease? Common.
So to wrap it up, guys, all my fellow juicers out there, keep an eye on your blood pressure, because if it's too high for too long, your kidneys are going to get wrecked.
Yes.
I guess the protein, I'm not going to talk them out of taking in a shit ton of protein. They're going to do that anyway. Hydrate. Obviously, most bodybuilders I know, they don't have an issue with being hydrated.
Yeah.
And that's really about all we can do to.
And check your liver kidney function. Excuse me, and check a urinalysis. And if you have any trace protein or even 1+ protein in there,
yeah.
It's a warning sign, man. And be careful with non-steroidal anti-inflammatory drugs.
Yeah.
Because a lot of guys train hard and they use it and they think it's just like candy, you know?
Yeah. I mean, I've known guys who will take like Advil or Tylenol every single workout.
You see, Bomback, they found this. These guys, I'm just reiterating what these guys have already discovered. That's that setup. Steroid user, hypertension, a lot of steroids, multiple steroids, mixed. They don't know what tren and equipoise is.
Right.
Steroid use, and then on top of it, hypertension, and then on top of it, a lot of non-steroidal anti-inflammatory drugs. When you have kidney disease, it's a no-no. Yeah. And when you have significant heart disease, that's a no-no also. Non-steroid, Motrin, ibuprofen, Aleve. There's a couple out there in the market.
Yep.
They do a good job of pain reduction and they're anti-inflammatory, right. but they also destroy and they block protective prostaglandins, and that's why stomach bleeding and kidney disease. And I got my med student in the room. That's for him right there. He probably knows more of this than me, right? I mean, that's how it works. You're blocking those pathways. There's some things that are good, but then those are things that are bad. We've known this for like 50 years. So, but the guys that are training hard, they're using all the Motrin every day. And when I say stop the Motrin, bring protein down, let's do some testosterone, and then within a month or two, oh my God, you see their kidney function as far as protein, they're losing. It cleans up.
Oh wow. It's
amazing to see because they're early and the kidneys still. It takes a beating. Yeah. It takes a beating, but then at a certain point, after 10, 20 years or whatever, none of this stuff happens. See, the problem with this is none of this shit happens overnight. So guys don't believe it.
Right. I mean, that's like anything else, like injuries in the gym. Guys in their 40s and 50s, when I was a young dumbass doing stupid things in the gym, they'd come over and try to lecture me. I'm like, shut up, old man. What are you talking? Leave me alone. That's you. You're a beat up, battered old man. That's never going to happen to me. And here I am at almost 50, and I'm walking around sometimes like I'm crippled. But
oh my God, Ron.
Well, Doctor, this has been another enlightening show. Go to the doctor's.
Sorry, I had to get crazy today.
No, that was nothing. So go to the doctor's video that he did called Steroids. What was it called? Steroids and Kidneys and Steroid Q&A. And like you said, the comments on doctors' videos are actually more entertaining sometimes than the actual video because you get testimonials from people that have gone through the things he's talking about, and these are real people with real stories to tell. Sometimes I find that stuff pretty fascinating when they tell their whole stories.
Incredible.
So check out the videos on Anabolic Doc. Pick up the book, America on Steroids, A Time to Heal. Also, the doctor is in Muscular Development Magazine every month. Check him out there. And, of course, for the people who say, how do I get in touch with this amazing doctor? Go to the website, metabolicdoc.com. You can reach him there. He's got an office in Hartford, Connecticut. He's got another one down in Boca Raton, what is it, Florida? Fort Lauderdale, Florida?
Yes. Going down next week. We're all booked up. It's going to be crazy.
Florida and late. Actually, I'm going to be in Tampa next weekend, so okay. We'll see. We'll both have the Florida experience around the same time.
We can't wait.
All right, everybody. Thank you, Doctor, of course, Dr. O'Connor, for your expertise, your time, your knowledge. Appreciate it. And everyone, thanks for watching another great episode of Ask the Anabolic Doc. We'll see you next time.